and Jeff, and we are going to be talking about occupational therapy's role during the postpartum period.
So right now there's many gaps in America's current postpartum healthcare system, but psychological stabilization and education are rarely addressed throughout the entirety of the postpartum period and also before the postpartum period. So occupational therapists have the ability to provide education and care during the postpartum period that can be critical in establishing long-term wellness for both mother and infant. And our thesis statement is occupational therapy practitioners will understand the importance of education pertaining to mental health, sexual dysfunction, breastfeeding, and ergonomic changes during the postpartum period as a means to promote successful participation in occupations and the overall wellness of mothers.
Okay, so really why we wanted to talk about all this, the problems we wanted to address was the maternal mortality rates being 66% right now in America. They found that 66% of the deaths have been preventable in America, and then 1/4 of those are because of mental health conditions, and most notably it has been due to suicide within that first year of giving birth. We've also found that 44% of infants currently are not being breastfed from the age of 0 to 24 months worldwide, which leads to a forfeit of wellness benefits for the baby and for mothers. As far as sexual dysfunction goes, there's 70.6% of women within the first 12 weeks that have stated that they are just having difficulty with sexual function. And then the injury, permanent degeneration, and chronic pain that is associated with poor body mechanics during the postpartum period also needs to be addressed for better outcomes overall. So really what our role would be is to be there and provide holistic support for women and education, just so that they're all listed here, but just so that these things can be addressed and improved.
So transition into motherhood is a big part of the postpartum period. The postpartum focuses on the shifts from caring for mom to caring for the infant immediately after childbirth. And every aspect of a woman's life changes and becomes disrupted when she becomes a mother. And little education for mom leads to trial and error methods. Postpartum challenges related to mental health conditions, breastfeeding, sexual dysfunction, and body ergonomics can affect a woman's life and her participation in all of her occupations, and it can affect her sleep. Pain is a big part of the postpartum period. To partake in her self-care, develop positive body image, adjust to her relationship with her partner, tolerate hormonal imbalances, address the needs of the infant, and keep up with household maintenance and logistics.
So the theory that we kind of based everything off of was the family systems theory. It places a primary focus on the exchanges of behavior that take place during the interactions between members of the family. And it argues that the following occupational tasks and skills can either be positively or negatively influenced by these family interactions, such as eating, sleeping, managing pain, coping with stress, maintaining relationships, bonding, achieving developmental milestones. So as OT providers, we can provide postpartum services to promote these family systems relationships that can benefit both mom and baby.
So the World Health Organization currently suggests that infants be exclusively breastfed from birth to 6 months of life. And then following that, from 6 to 12 months of age, breast milk is able to provide half the nutrients that they require. And from 12 to 24 months of age, it can provide up to a third. It's commonly known that breast milk and breastfeeding is very beneficial to the baby and the multitude of benefits that it gives to them, but less known is the benefits that are given to the mother as well. So those can include decreased risk of disease, hormonal changes that accelerate the return of the uterus to its normal size, reduce the occurrence of postpartum hemorrhage and anemia, increasing pain threshold, which in turn increases feelings of love for the baby. It can be up to 96% effective in preventing pregnancy during the first 6 months of the postpartum period as well. It can increase sleep and sleep quality, reduce stress and anxiety levels associated with the transition into the role of motherhood, and reduce the risk of postpartum depression. And it's also known that the more that a mother partakes in breastfeeding, the longer they breastfeed, the more possibility is that she would gain some of these benefits. From 2015 to 2021, only 44% of infants aged 0 to 6 months were exclusively breastfed, worldwide, and even less than that is the number of infants who were supplementally breastfed for the next 24 months. Reasons for decreased adoption of breastfeeding and early cessation can be both physical and mental health difficulties. So then these are just some of the studies that I pulled out that I thought were important in identifying the best ways to support longevity and initiation of breastfeeding. So single-family rooms in the NICU facilitate earlier first impression and attempts, resulting in more infants being exclusively breastfed from discharge to 4 months when compared to the open bay design. And then the adoption of the proactive model in hospitals provides consultation with a board-certified lactation consultant to all admissions rather than those who just present with already established feeding difficulties. And that resulted in a 5.9% increase in acceptance of mother's own milk and an increased average monthly supply of breast milk. A Canadian study looking at community support with home visits by a lactation consultant found that women reported it being effective in addressing physical barriers, practicality, and breastfeeding self-efficacy. And then counseling provided by students at an urban university hospital was found to increase knowledge of maternal breastfeeding benefits from the start of the program to the end of the program. And it also strengthened women's intention to breastfeed. Workplace support can be a huge one that they discussed. So high quality lactation rooms compared to either no lactation rooms at work or low quality lactation rooms have a major impact on longevity of breastfeeding and the decision to breastfeed in general. And then another study looking at virtual and social media support was found to provide community support, normalized breastfeeding, and was perceived to improve breastfeeding outcomes. And then the groups that were ran specifically by lactation professionals were indicated to provide high levels of informational support and facilitate moderately high levels of breastfeeding self-efficacy.
So whenever we think about ergonomics in breastfeeding, we think about neck pain, specifically breastfeeding-related neck pain. Lactation consultants, in conjunction with OTs and PTs, recommend that nursing mothers should regularly change their breastfeeding positions to increase the relaxation and comfort of both mom and baby. Occupational therapists can play an important role in teaching postpartum women how to incorporate proper body mechanics, joint protection, and energy conservation principles into their breastfeeding and their daily routine with new baby. Increased postpartum breast mass may be a cause of persistent lordotic curvature, changes in the lumbar spine, and there's a potential that this may cause postpartum back pain. And the postpartum back pain and the postpartum neck pain are a lot of the reasons why mom quits breastfeeding, which can have decreased benefits for the baby. So infants are most likely to eat every 2 hours, which can cause continuous strain on the body. So it's important to remember to sit in neutral spine position with an ergonomically correct chair, also using a footrest. Maintain better feeding posture by using a support pillow to raise the baby, such as just a regular everyday pillow, or they have boppies or other devices that you can use. And then make sure you set up a nursing station where everything is accessible to you during breastfeeding times to avoid reaching or twisting while you're breastfeeding baby.
Okay, so as I mentioned earlier, the maternal mortality rates as well as mental health conditions are on the rise for women. And right now we need to focus on providing psychological stabilization as well as like a physiological stabilization that's currently utilized through education. Even though that's rarely addressed now. And then the lack of education for women and their mental health, it helps to explain maybe why the maternal mortality rates are so high currently. So right now, Schwab has claimed that childbirth is one of the most intense and emotional experiences that a woman can have that leads to many mental health diagnoses. And then these diagnoses themselves can be a big barrier to interfering with their ability to participate in all their occupations and to even have life satisfaction and infant success. So this is just a list here of some of the impacts that mental health diagnoses can have. Some big important ones are being able to participate in leisurely and self-care tasks, being able to maintain a proper development, safety, and wellness track for her baby, being able to return to work, and decrease her risk of long-term somatic and psychiatric morbidity. And then here's just a list of some of the common diagnoses that are seen in the postpartum period. There's baby blues, there's postpartum depression, postpartum anxiety, and then postpartum psychosis. The biggest one to hit on in preventing earliest is baby blues, because it's technically not a diagnosis, but it goes to show that 26% to 84% of women will experience some of these baby blues or depressive symptoms, which can further develop into more serious diagnoses like these, specifically postpartum psychosis. In the end, it could lead to a mother attempting to either harm herself or her child with maternal suicide or infanticide. Okay, so in addressing postpartum mental health, we as OTs can promote maternal wellness, life satisfaction, and infant success overall. There are a couple evidence-based interventions that we have found in our research that can be taught through psychosocial and therapeutic strategies. So a big thing really is just kind of educating a woman to not be so, I guess, shameful or just having negative self-talk or feelings of guilt for herself. Just kind of allowing her to have more of like a gentle self-talk with herself, which can really help improve her mental health. And then also just establishing healthy self-care routines that are well-balanced. Going back to occupations that are enjoyable, even with baby, and then just some of these other ideas for wellness, such as spirituality, breathing, journaling, yoga, creative arts, making a planner, those sorts of things. So then there's just some agreements. Right now, my voice is cracking. Right now, there's the Happy Birthday program in which a current OT implements maternity services or OT services in the maternity care pathway. And she's looking at providing mental health services to women within that first 6-hour time frame of having a baby, because she claims that if there was a traumatic birth experience, then if you address that within 6 hours, then their likelihood for mental health in the future is improved, decreased. She won't develop conditions to address. And then Podby and colleagues also urged the inclusion of women's health into OT programs, just so students can actually all be educated, and then hopefully that will improve access for mothers later on.
So most people wouldn't think that ergonomics has anything to do with mental health, but actually many studies concluded that physical pain related to the ergonomics of a postpartum mom can lead to false positive results when screening for postpartum depression. Physical pain related to ergonomic factors can increase the risk of developing postpartum depression. So some things that you can do is doing adjusted sleeping arrangements to keep baby closer to mom throughout the night and even sometimes throughout the day. This can put mom's mind at ease throughout the night and make her have easier access to the child at the night for feeding.
And then for sexual dysfunction, it was found that 70.6% of women report experiencing some sort of sexual dysfunction 12 weeks after giving birth. Just some areas of sexual dysfunction. The 4 main ones are sexual desire dysfunction, sexual pain disorder, sexual arousal disorder, and female orgasm disorder. Education is a big role that OTs can play in sexual dysfunction for the postpartum period. Sexual dysfunction can correlate to hormone imbalances, adapting to a new role, breastfeeding, and altered body image, and much more. Some education tips that SSOTs can give is explain to women how low libido can cause hypoactive sexual drive. The 6 to 7 weeks after giving birth to a child leads to low libido. Breastfeeding before sexual activities, lubricant to prevent dyspnea, which is painful sex, and then not addressing painful sex can lead to fear of sexual activity.
So for ergonomics related to postpartum sexual dysfunction, it's really all about physical recovery from the childbirth. So if you can properly recover from childbirth, it can decrease your chances of getting any sort of sexual dysfunction disorder. So it's important to manage your pain. Make sure you achieve your abdominal wall recovery. return to pre-pregnancy or just a healthy weight in general, achieve proper sleep and rest cycles, and then also if you utilize hip wedges for more comfortable times during intimate moments.
So the biggest takeaway that we found through our research was education in every single part of the postpartum process that we targeted and that we found in research was that education can be used to prevent and treat these issues during the postpartum period. So, and that goes for education in the school system for us as OTs to advocate for our role in postpartum care and also for mothers who are experiencing these issues. And then moving forward, we think it's important to advocate for both the recognition of OT's role in women's postpartum health and overall just acknowledge that there's a deficiency of services available for women in the postpartum period. And then these are our resources. Questions?